Hi, I'm Eric Mansfield. I'm a licensed clinical social worker, and this is Practical Mental Health. So, what is practical mental health? I just want to give you an overview of like how this channel might go. This is my plan. This is kind of the direction I want to take it. So, the reason that I chose the title Practical Mental Health is the word practical itself. To give you the textbook meaning, it means of or concerned with the actual doing or use of something rather than with theory or ideas. At least that's Google's definition, or what I pulled up off of Google. It really boils down to what you can actually do in order to be able to maintain mental health, your good mental health, hopefully. Now, the textbook definitions, it says rather than theory or ideas. However, we have to have theories and ideas in order to be able to put things into practice. We have to come up with ideas, new ways of doing things. That's how people grow. That's how even societies progress. We test theories. We test ideas. And when we find that certain things work, then we put those to actual use. So that's what I'm here for. I want to encourage you to use some of the information. Use the information that I'm putting out. There are other people who are mental health professionals. They're putting out great information. They have great ideas. I would encourage you to look for other people, get the information from multiple sources. Usually that will help to verify the validity of basically what people are experiencing, especially when it comes to professionals. What we're seeing in the therapy office, what is actually working, what's not working. There's just a lot to it. But the idea of just being practical, like not just having an idea in your mind, but pursuing it, doing it, engaging. And you'll hear me say this a lot, success does not come without effort. What you practice grows stronger. These are phrases that, they're bouncing around the internet and all that stuff, but they are absolutely true. You're not going to accomplish anything just by sitting on your butt thinking about stuff all day long. Trust me, I spent a lot of time sitting on my butt and thinking about things. But that was one stage of my life that I'm not going to get into the details, but now it's all about taking action. If you have an interest, if you have ideas of things that maybe you want to do, or maybe you don't know what to do, even if you don't know what to do, this even is a first step. I can't necessarily tell you where to go or what to do or how to do it. I can give you some ideas, but I want you to put your ideas into practice, and I could probably give you the tools for that. So can some of these other mental health professionals and therapists who have a presence on social media. I'm not the end all be all. I mean, I certainly don't know everything. I am what I would consider myself an expert in my field, but at the same time, I don't consider myself to such a degree that there's nothing left to learn or there's no room for growth. I'm all about learning, trying to find new ways of doing things. And that's one of the reasons why I'm actually doing these videos, is because I am not like anybody else. Neither are you. And everybody is an individual in their own right. I have a different way of presenting. Hopefully it will resonate with you. If it doesn't, that's okay. I'm not going to be offended by it. Everybody has to find what works for them, especially when it comes to finding a therapist or even somebody that has a presence on social media or wherever it may be. If you're not feeling it, you're not feeling it. It just is what it is. That's just, it is what it is. So One of the things that I tend to do too, like when it comes to a practical approach, I try to do the best I can to remain neutral. I don't take sides. I've found that the moment that anybody takes a side, and I'm kind of thinking, either politics, religion, or, certain belief systems, or whatever it might be, determining whether you're right, wrong, or somebody else is right or wrong, it doesn't matter. The moment that you take sides, you develop bias. So I have my own biases. I admit that. There are certain beliefs that I hold. There are beliefs that I don't buy into, and approaches that I don't buy into. But you know what? That's okay. Not everything is going to work for everybody. However, maintaining a neutral approach helps me to reduce my bias, and I hope that I don't infuse any sense of bias on you with regards to these videos and the approaches that I'm going to present to you. So the other purpose for this is for education. You're going to hear me say this a lot too, as far as like, how are you feeding your mind? Education is a method of feeding your mind. That can go in so many different ways, that it doesn't matter. You can feed your mind good information, or you can feed your mind bad information. You can feed your mind good, healthy, nutritious, thought producing information, or you can be feeding your mind junk food. That would be, I wouldn't say it's total junk food, but like certain types of video games, watching social media, anything that, probably increases a lot of the dopamine, but without really good, positive, lasting good results, like the idea of, long-term feeling good. So that's the idea. Education piece, also reminders for clients. So I'm probably going to tell all of my clients, hey, I've got a presence on social media. Go to this website and check out these videos. They may be more tailored to, like I might actually have specific videos for specific clients. That's one thing that I've noticed, that not everybody's the same, but there is a trend, and a lot of these videos are coming out as a result of therapy sessions and the things that I discuss with clients. It's also for memory reinforcement. So also with regards to, you can watch these videos as many times as you need to. There are, like I said, other people. Hopefully the idea is that when you have mental health professionals, we're all probably getting the same information, and we're all probably putting out the same information, hopefully in slightly different ways. So that way it resonates with people in different ways. One mental health professional may put it out in such a way that a person, they're kind of like, okay, I kind of understand that perspective. But then you watch somebody else and it's like, oh, now I get it. That's the purpose of putting videos out that are in a different way, I guess. But hopefully with the same information that you're probably hearing, it's just being presented in a different way. Hopefully that it will resonate with you. One of the things that I tend to do also is, there's this old term, thinking outside the box. I don't just think outside the box, I live outside the box. I kind of look at the modalities are contained within boxes. And this is just my perspective. This is my point of view. They all have their structure. They all have their method and their ways. In a lot of ways, each of these modalities as a standalone, yes, they work as prescribed. But the thing is that if I just stuck with what was in the box, I guess I would end up being a cookie cutter therapist, and I'm not a cookie cutter therapist. I don't just, one size fits all. I don't do that approach with clients. Every single person is an individual. So what I end up doing is I kind of like have all these boxes, the modalities, and I will cherry pick and basically form a recipe for clients. And hopefully the idea is that I can demonstrate that through these videos, is being able to explain how like a modality or certain aspects of, say, CBT might go well with certain aspects of DBT or ACT or any number of the modalities, as far as like being able to bring all of it together and have its own unique recipe. There's 1,000 different ways to bake and flavor a cookie or a cake. That's no different for mental health. And with every single person, every single client that I see, it is a different recipe. Let's see. So something else that you're going to notice too is that I am not going to be editing. I have editing program that I'm going to use, but hopefully the idea is that you're not going to see my face and head skipping around because I cut in order, to save time and all that stuff. When I watch videos, it's fine, but at the same time, I kind of find it annoying on a low level. When I see other people, their head will like skip here, skip there, but the words continue, and I'm kind of like, okay, what was in between? What did they skip over? Was it because they fumbled and jumbled their words, got caught up, or maybe they said something inappropriate and like needed to get it out of the video? I'm going to do the best I can to make this fluid, because the way that you're seeing me right now is the way clients see me in the office. It is not a cut and paste situation. Therapy is not cut and paste. The videos should not be cut and paste. So if I do cut and paste, there's probably a really good reason. This does take time, actually, in trying to produce these. Making videos, I thought in the beginning it would be easy, a 15-minute video, 30-minute video. Yeah, how much time is it going to take? Yeah, 15 or 30 minutes. No, this has turned into a full-time, part-time job. Just trying to figure out the logistics, trying to figure out the camera, the sound equipment, making sure that everything is correct, making sure that the space that I'm presenting in, just everything. So hopefully with these videos too, I'm going to kind of take you out. I don't like being cooped up and isolated inside a box. So that's the idea too of living outside the box. I actually prefer to be outside doing things. Yeah. So, in the wintertime, I only really have 2 days out of the week in order to be able to do anything that I enjoy. I enjoy doing the videos, but I don't want to spend every weekend of the rest of my life focused only on videos. There are other things I want to do. I hunt, I fish. I just started fishing this year. Freshwater fishing, that is. So that's something that you might see. I'm not going to do fishing videos, but I'm going to do mental health videos probably while I'm fishing. I will be doing probably mental health videos while I'm in the woods sitting and waiting. Those will be delivered with a whisper, of course. So yeah, so that's kind of the idea of like what I'm going to do, hopefully, with this channel. Subscribe, don't subscribe, it's up to you. I would appreciate it if you did. It would definitely be helpful for me. I'm not concerned so much about the money. I'm more concerned with providing good, useful, practical information that people can use. And another thing too is like you're going to hear me say a lot. I am outside of my comfort zone standing in front of a camera. This is not something that I do on a regular basis. And quite frankly, up to this point, making this video, I have already made dozens and dozens of videos and trash them because of one problem or another. So I think I got all the equipment down. I think I understand how to do that. But you're going to hear me say a lot because I'm talking to a camera. I know you're out there. I know the world is on the other side of that lens. But I can't see you. I don't know who's watching. I don't know where you are in the world. Usually when I'm in sessions and if I have conversations, it's with other people and it's fluid, it flows. When I'm out doing things on my own, if I'm fishing or if I'm hunting, I'm not talking to anybody. I'm quiet. I'm a very quiet person, very reserved. So this is really way outside of my comfort zone, but I also want to use this as encouragement for anybody who might be struggling. And with regard to what do I do? How do I get going? How do I get myself moving? So in other words, this is not an easy thing for me. Hopefully it will get easier because what you practice grows stronger. I know, it's that idea of just getting the ball rolling. But I'm not a professional videographer. I don't act for a living. This is not an act. Like I said, I'm probably not going to cut and paste, so you're going to get the full raw version. I do have editing equipment now. There were a few videos that I made before this where I probably stated in there that I don't have any editing equipment, but I'm going to do the editing to a bare minimum. I'm not even sure how all of this is going to develop, or if it is going to develop. I guess we'll see. But success does not come without effort, and you have to make effort. And that's what I'm doing. That's what I encourage people to do. And I hope this serves as an example of what can happen if you make the effort. Heck, all you have to do is look at every video that's ever been published on YouTube, Rumble, or whatever. I'm hoping that stating those names doesn't get me into any issues. So okay, that's pretty much, let's see, I guess. Oh, the other thing too, comment or don't comment, up to you. I'm probably not going to read any of the comments. Like I said, I have a full-time schedule at work. I don't have time to read comments. If you want to comment, if you want to create a conversation below or to the side or wherever it might be, by all means do so, but just don't expect me to respond. Just being honest and forthcoming with regards to that. I don't mean any offense to anybody. That's just the way it is. When the weekend comes, I'm hitting the ground running, doing what I enjoy doing and living my life the way that I want to live my life. I have opportunities now that I didn't have before, and you can be sure that I'm taking advantage of those opportunities at this point. We don't live forever. So subscribe, don't subscribe. I would appreciate it if you did. Comment, don't comment, whatever. I'm most likely not going to read it. You will find too that at the end of every video, I'm going to wish everybody well. I hope you have a wonderful life. That doesn't mean that you are having a wonderful life. My wish is for you to have a wonderful life. And that is another reason why I'm making these videos, because I want to help you progress, I guess. I want you to live the most fruitful life that you possibly could. If these videos help you get past issues, or if it helps teach you how to manage your thoughts and emotions and behaviors, even if you right now feel like you're not living the most wonderful life, the potential is there. Success does not come without effort. Make the effort. You can do this. If you're living and breathing, you can do this. You just have to find your way. Doesn't necessarily mean that I know your way, or I can kind of help point the direction, but that's about it. I can't tell you what to do. I can't tell you how you have to do it. I can tell I can tell you how to do things, but I can't make you do it, if that makes sense. Okay, so that's pretty much the end of it. Also, another thing too, at the end, I pretty much tell everybody that I love you all. And I don't care who you are. I don't care where you are in the world. I don't care what your beliefs are. I don't care if you're a saint or a sinner. I mean, it's a brotherly love. And I absolutely believe that everybody has the potential for being good, decent human beings. And I don't agree with everything that people are doing. But at the same time, that's all part of practical mental health, is being able to agree to disagree. But I'm not going to put people down because I disagree. I'm not going to tell you you're wrong. You have to live your life. You have to figure out how to improve the quality of your life and be you. Don't be afraid to be you. And I'm going to be me. Okay, so subscribe, don't subscribe, make comments, don't make comments. I hope you have a wonderful day. I hope you have a wonderful life. I love you all. Take care.